to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Alana Nichols, a new pediatrician and internal medicine specialist at Terrebonne General Health System. Welcome to the show, Dr. Nichols.
Thank you so much for having me.
Well, let's get started with you telling us a little bit about yourself and your role at Terrebonne General.
I'm new to Houma, been here for 2 months, moved here from Birmingham, Alabama. That's where I went to residency, but originally from North Louisiana, a very small town there, 450 people, so really big metropolitan. But am here at Terrebonne practicing as both a pediatrician and internal medicine physician.
I understand you studied law and you were a practicing lawyer. What made you transition to become a physician?
You would think that I'd have that answered down because that is usually the first question that people ask me, like, what in the world made you go back? Right. So yes, I was a criminal defense and family law attorney in Atlanta, Georgia for about 5 years. I've loved being in the courtroom. I loved advocating, but so many of my clients had undiagnosed or untreated mental disorders. And it was something that I saw over and over again. And I feel like I might have been on not the wrong side of things, but I started to feel like maybe there is a different way that I can advocate because I realized that's what I really liked about practicing law was the advocacy.
So did that lead you to become a doctor?
It did. I started to transition and I didn't have any of my prerequisites for medical school because I was like full steam ahead for law school. And so went back to school to do my prereqs. But medicine wasn't like a completely nebulous idea for me. I grew up in a house where my mom, she was the dean of a nursing school in Mississippi. And my dad was internal medicine, so he had a practice in Louisiana and Mississippi. So I grew up around medicine. I just did not realize that it was something that I was going to be doing until later.
Your parents were probably like, I can't believe you're not going to do this.
Yes.
You went in a totally opposite direction.
Oh, absolutely.
So why did you decide to go into pediatrics and internal medicine? You couldn't make it easy, right? And stay with one thing.
That's exactly what my mom said. She's like, of course, you picked that. I had no idea that internal medicine and pediatrics was a thing until medical school in my clinical rotations. My very first rotation was pediatrics, and I loved it. And the senior residents on my team were med-peds. And I was like, what is that? Like, what does that mean? What does it stand for? But I loved on pediatrics the way they seemed to be the people in the room that were very calm. They were able to think a little bit outside of the box when dealing with the pediatric patients. And I love that. And I didn't really get that feeling about the area that I wanted to practice until my very last rotation, which was medicine. And then, as luck would have it, my senior residents on medicine were med-peds. And so then I got to see it from the other side. So when dealing with the adult patients, the med-peds residents had a very special way of being able to communicate with the patients that it was just far superior to some of the other people. And I love the way they were able to kind of flip back and forth. And so I've learned more about the subspecialty. And I realized that the same way I felt my very first rotation I didn't feel that way again until my last one. And so I was like, I don't have to pick. I can do both.
You can do both. Why not?
Why not?
As a pediatrician, tell us a little bit about your role and the types of patients you treat.
I see from newborn all the way up to 18 in the pediatric clinic. And luckily, the majority of children are well. And that's why we call them the well visits, right? And so in the very first stages of life, the first couple of years, you're seeing them a lot more often, but you're also getting to know parents or their caregivers and siblings. But you really are making sure that they're on track with development and making sure that parents are comfortable and making sure they're getting the proper nutrition to set them up for success. It really is, not just about sniffles or just the things that you first think about when you're thinking about health. You are making sure that they are on track with school and you're truly getting to know them. And then once they get to a certain age, those appointments start to spread out. And so in best case scenario, you're only seeing them once a year after a certain point.
Right.
And then you obviously have the kids that come in with the acute illnesses, runny noses, ear infections. And so we see a lot of those, especially when it's that time of year. But you're seeing them for everything. Best case scenario, you're not having to see them that often because they're healthy.
And as an internal medicine physician, tell us what your role is like in that capacity.
So then I get to deal with the rest of the spectrum, right? So I pick right up at 18 all the way, into our elderly population. And, I think that coming to a new place and practicing, I am able to care for people who may not have had a primary care physician in a while. And so what I like patients to know is that when you come in that first time, I am someone who wants to get to know you as the person, not you as the different disease processes that you may have going on. And so it may take a couple of appointments to get everything under control, to get everything squared out, to see where we are with our wellness visits, to see what screenings we're behind for or that are coming up, to see what our blood pressure has been and what our, blood glucoses have been. So for me, if it's my very first time meeting them, it may take 2 or 3 sessions for us to fully get to the point where I can then start spacing them out and seeing them as needed.
What are some of the most common conditions you see in your adult population?
We see a lot of hypertension. We see a lot of diabetes. I think that is probably our biggest population when we're talking about chronic illnesses. We see a lot of people who are struggling with weight. And so even if they don't have the comorbidities that come along with that, they are coming because they want to prevent that, right? And because they see what it looks like when it does progress to that point. And so I think those are probably the biggest things. We see a lot of, pulmonary issues, whether it's diagnosed COPD or asthma, or just a chronic cough in between. It's typically your bread and butter, and I think that's pretty common in the South.
Well, we like to eat and drink around here.
Yes,
So
absolutely. I'm not going to be the person that's going to say, you better not ever do that. I don't think that that's realistic. I try to have a motto of truly meeting patients where they are, right? Coming in, trying to start with a clean slate, knowing that if there's something that I do need to tell you that's important, we're going to have that conversation, but also understanding that we're human. Right. And so you really do have to understand people and meet them where they are and try to make decisions that they're going to trust you and we're going to be able to move together, move forward together. Ultimately, the goal is their health. Right. And so you really want to be a partner in that.
Yes. And how has your training, since you're trained in both areas, enhanced patient care and how you care for your patients?
I think that what I truly appreciate and what I have been able to find is the same thing that I saw in my senior residents, right? Like when a mom comes in, and I don't think that it's just the training, but also just life in general. When I started training, my children were 5 weeks old, right? And so I was learning medicine and going through medicine, going to doctor's appointments, right? So I think that being on the pediatric side, being able to relate to mom, because I know that mom could be one of my patients right across the street, right? And understanding that when we're coming in, you have to give parents grace. Their kids are sick, right? And they want what's best for them. So kind of keeping that in mind. But then also going to the adult side and realizing some of the tools that I learned with dealing with children, not saying that adults are children, but some of that compassion and having some of that patience that you learn dealing with kids that are climbing over you and rolling over you when you're trying to examine them, some of those skills do come in handy on the other side. And so I think that there are just some traits, some characteristics, some skills that you just kind of naturally pick up when you're dealing with one population that translates over to the other side.
Yeah, we're all alike for the most part.
No,
right?
absolutely, absolutely.
And yeah, so how do you stay current with both practices?
It is definitely a juggle. So my training is a 4-year program. And so typically pediatrics is 3 years by itself and internal medicine is 3 years. They combine that and make it 4 years and cut out a lot of the extra stuff, a lot of the extracurriculars. And so you kind of get into this motion. Our program is set up where every 3 months you flip from the adult side to the pediatric side. And so you're constantly going back and forth, which is why when I was searching for what my next step would be, I wanted a position where I would be able to, within a week, see adults and kids, because it forces me to stay on top of things, right? I am going from a day with just adults to a day with just children. And some of my days are split between adults and kids. And in doing that, I am forced to stay on top of the most common ailments with children, just as much as I have to stay on top of how the changes that are happening with chronic conditions that affect adults, because there are some differences between the two, right? And then our governing boards require us to, just like there are requirements for questions and staying on top of things and getting your continuing medical education. On one side, I have those requirements on both sides. So there's always someone behind me that's making sure that, hey, are you staying up to date on everything that's on the pediatric side that's going on, as well as everything that's on the medicine side?
And so why are well visits so important for pediatric patients as well as adults?
So that's a really good question. And I think there is a misconception or maybe a little bit of confusion more so on the adult side than there is on the pediatric side. So on the pediatric side, we hear well visits. And it's something, that I touched on a little bit before. The well visits for children are, set points where we are able to check in with parents to see how they're doing, but also making sure that kids are meeting their milestones, right? So we're making sure that they are growing as far as weight and height, but also making sure that they are growing developmentally, that they have the proper motor functions, that they are interacting socially appropriately, and having the well visits we're able to track that. And if we see things that are falling behind, we're able to stay ahead of it. And it also is important to be able to keep them up to date with their vaccinations and making sure that they are growing appropriately. And so those things are based around the schedules that we get from our governing organizations and from recommendations from other agencies, to where we can kind of tie it up in a nice little package. Check in on mom, make sure our children are growing well, but then also making sure that they're getting their vaccines and staying on top of things. The adult side, the wellness visits are a little bit different, because it's hard to explain to patients that, you're coming in for this wellness visit, but we're not talking about everything that's going on with you. It's our opportunity once a year to basically make a roadmap of everything that's going on with them, right? Making sure that we not only have a clear picture of your health, but where are we behind on our screenings? How can we set this up for success for you to be able to have those? But then also, what are the obstacles that are stopping you from getting there, right? Do we have socioeconomic things that are impacting your ability to get there? Do we have some lapses in our health literacy that's making it hard for you to be able to stay on top of your medication? And so those appointments are supposed to be an overview for the things that we need to focus on when you come in over the next year.
Oh, well, thank you so much for sharing this great information with us.
Absolutely.
We really appreciate it.
Absolutely. Thank you so much for having me.
For more information about Dr. Nichols, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcast.